perineal body. Okay, if there is stretching of the vagina during the delivery, at that time there might be stretching of the perineal body itself, and sometimes there can be tear. Okay, so there can be tear. To prevent this tear, actually they do something called as they cut. That's the gynecologist, whoever is there, he will cut, but he will give a cut beside the perineal body. He will give an actual incision beside the perineal body to prevent the perineal body from tear. So that is called as episiotomy. If you have heard, I don't know whether you have heard or not, episiotomy. To prevent the perineal body from tearing, so he will give a side cut.
Labor?
During labor, yeah.
Every labor or?
Not every labor. He will see what exactly is the position. If there is overstretching and it seems there is a big baby and the pelvic cavity is small, and there might be chances, okay, of tearing of the perineal body. To prevent perineal body from tearing, he will give a cut. Okay, but beside, not on the perineal body, beside the perineal body. And this is called as episiotomy. This cut is called as episiotomy to prevent the perineal body from tearing. Okay. So this is how it is present, the rectum and the anal canal. So you can see the relations. So and here we have the bladder, the upper half, the lower half. We have the urethra. Here behind there is the rectum, and here in the upper part it is separated from the uterus by a pouch. Okay, fold of peritoneum, which is forms a pouch. Which forms a pouch is called as the pouch of Douglas. This is the pouch of Douglas. Most dependent part when the person is erect. Okay. When he is lying down, the person is lying down, then the most dependent part are something called as paracolic gutters, which are beside the ascending colon and descending colon. Okay. So depending on position, it will change. Okay. So in erect position, this is the most dependent part, pouch of Douglas. Okay, which is also called as the recto-uterine pouch or recto-vaginal pouch, because it might go up to a certain extent up to the vagina also. So that's what is called as recto-vaginal or recto-uterine pouch. In the front, we also have a pouch. So this is a lesser pouch compared to the pouch of Douglas. This is called as uterovesical pouch. Uterovesical pouch, because it is between the uterus and the bladder. Vesico means bladder. Okay. So this is how it is present. Okay. And beside that, if you can see here, there are fallopian tubes and the ovaries. Here deep inside, you can see the fallopian tubes, and on the side, you can see the ovaries. So as I said, ovaries are the only organs which are intraperitoneal. You go and open into the peritoneum. As your friends were asking, so this open peritoneal cavity will lead to a lot of complications. If there is any infection in the vagina or the uterus, it can directly go into the pelvic cavity, into the peritoneum, and there can be peritonitis. Okay. So more chances of peritonitis in case of female compared to the male through this route.
But the peritoneal body is collapsed, right? The peritoneal body is collapsed.
That is perineal body. Perineal body. Right now I was talking about the peritoneal cavity. Okay. Peritoneal cavity, perineum. Okay. Perineal body. Perineum means wherever we have the external genitalia, there the part is called as perineum. Okay. Now you can see here. Okay, the same section as this one. Okay, longitudinal section we have taken so that it can be two separated and you can see the relations. Now here you can see the uterus. This is the uterus. Somewhere is sitting behind. Okay. So this is the uterus, and in the front this is the bladder, the cavity of the bladder. Okay, and here we have the urethra below this. Okay, below is the urethra, and just behind that is the vagina. Okay, so as you know, there is an anterior wall which is shorter compared to the posterior wall, and this lower part is called as the cervix. This is the cervix here. This is the uterus. Okay, body of the uterus, and this is the cervix below. body of the uterus and cervix, and you can see the cavity. Cavity is very small. Okay, this is non-pregnant uterus. So
all is gross.
this one. This is the uterus, and here is the cervix. Okay, and this is the small cavity of the uterus. Very small. Ovaries. Okay. If you see here, beside that, there is the fallopian tube. Okay, fallopian tube is beside that. You can see it is not looking like a tube because it is covered by peritoneum. This is called as the broad ligament. Okay. So as I said, imagine that the person holding his two hands like this. So imagine this is the body of the uterus and these are the fallopian tubes. And somebody has put some cloth on it from above downwards. So whatever is hanging, that will be called as the broad ligament. So here you can see here, this is the broad ligament.
And the bladder.
Bladder is here. Yeah. So here, besides the fallopian tube, on the fallopian tube, you can see the broad ligament. Okay. And behind that, there is the ovary. It's difficult here. And here you can see here, what is this? What is this here?
Fallopian tube.
This is the this is the round ligament. This is the round ligament. There is broad ligament, which is a broad fold of peritoneum, and this is the round ligament. This round ligament is the actual ligament. This is fibromuscular. But broad ligament is just a primary support. But broad ligament is just a peritoneum fold. Okay. So this can be seen here, and fallopian tubes are deep inside. Okay. This one, which can be seen. Yeah. See here, you can see here. This is the ovary. This is the ovary. These are the ovaries. This is one side ovary, on the other side will be the other. The ovaries. Small one, almond shape. Yeah, almost oval shaped structure, which is the same here. Okay. That will be the ovary. Okay. So this is about the different organs. The fallopian tubes, ovaries, uterus, as well as you have seen the genital system. So this is about the structures. If you have any doubts regarding this, if you want to see something, you can ask me.
The
Which
brain
one?
body.
Yeah, this is just I wanted to show. This is the fetus. Okay. Still not completely developed. Maybe this is the real. Okay. Development might be there was death of the lady and fetus, so they dissected out.
Is that real one? Real one?
Real one, yeah, this is a real one. The back has been dissected so that you can see the spinal cord and other developments. Okay, so you can see the spinal cord here.
Doctor, the brain body, what is its nature? The brain body.
Perineal body. It is nothing but a muscular body, where all the muscles are invaginating.
Yes, the
so
nature.
because they are invaginating, all come at to one particular point. There it is thickened as well as it is strong. So because all are coming and getting inside. If you have a tent, all are pegged to one particular point, that will be a strong point. If you remove that, the whole tent will fall. Similarly, here all the muscles are coming here. Okay. It is nothing but muscular body. It's quite complex. Quite complex. Yeah, but complex. If there is even slight damage, then it leads to the collapse of the whole tent. Okay. Okay. What else? Anything else you want to see here? Anything we missed?
Abajil.
Doctor, the real one is very difficult.
Real one is
Difficult.
the structure, and by feeling and touching, you can come to know how thick will be the artery. When you feel and understand why it is thick, how it is thin, so you learn many more things. Okay, and when you go for surgeries, at that time it becomes much more easy. Then suddenly from here, from PVL system, you go into the surgery rooms, and at that time it will be much more difficult.
Yeah.
Because you don't have the practical experience of that. There, the whole year they will keep on dissecting. In previous system, there is no practice at all. We don't have sessions. In case of traditional system, every day from 2 to 4 they have dissection. Each student will dissect and see.
We have university activity, doctor.
Yes, we are not